Good evening everyone. Becoming a parent is a dream of every couple. So on the occasion of World IVF Day, let us discuss about some of the myth about IVF with the person who has experience of 2 decades in IVF. Doctor, who should consider IVF and what are the people will be benefiting with IVF?
Um, Happy World IVF Day to you, Doctor.
Thank you, ma'am. Thank you so much.
So this is my colleague, Dr. Sushma, and she's interviewing me today on this World IVF Day. So as we all know that today Louis Brown was born in 1978. That's why we celebrate World IVF Day. Now coming to your question, doctor, that whether it is who all should go for IVF. So everyone does not require IVF. IVF is in case there is a failure to conceive after 12 months of unprotected intercourse, then we start something called as artificial reproductive technology comes in picture. That does not mean IVF. It can mean timed intercourse, it can mean IUI, and lastly comes IVF. So specifically if you ask me about IVF, of course if there is a tubal block or if the sperms are severely affected quality wise or number wise, if the sperms are very less, in that case we can go for IVF. And if there is a as I said, tubal blockage is one thing, but if there is a hormonal imbalance or if there is endometrioma or there is a repeated failure to conceive with IUI cycle or with timed intercourse, or there is no diagnosis, like we could not come to any conclusion as to what's wrong with this couple, in that case also we consider doing IVF, especially in cases where there is a lot of hormonal imbalance and maybe the quality of oocyte is not that good, and unfortunately we can see the sperms under the microscope, we cannot do that with the oocytes unless we retrieve them outside the follicles. So for that we have to go for ovum pickup, and that's why we have to do IVF. And if it is severe oligozoospermia or any sperm factor, in that case ICSI is the procedure that we consider, that is intracytoplasmic sperm injection, which many might not be knowing about, but this is a very good procedure and can be done for a very low count of gametes, like whether it is sperms or oocytes. It can be performed, and it is routinely performed in most of the IVF centers.
So ma'am, are you saying whatever the couple goes for IVF, will it be successful in first attempt only?
No. So as doctor, you yourself know, and you are also working with us in this field, that first attempt itself, it is successful at Siddhagiri, Jananee, because we do lot of preparation work. So if you are well prepared, your -1 cycle that we call here is for the preparation of the uterus, of the ovaries, of the sperms, everywhere. We have this holistic IVF program wherein we do lot of detox. Mostly the patients which come to us have already gone to other centers and failed, and then they come here. So we do have a holistic IVF wherein we do lot of preparation for these patients. So our patients, I would say 7 or 8 out of 10 get pregnant in the first attempt itself, but yes, the remaining 2 or 3 cases do require second or third cycle also.
So ma'am, I want to know about what is this SMA and why did you start this initiative?
So SMA is Samruddha Matrutva Abhiyan. Samruddha means prosperous, Matrutva means motherhood, and Abhiyan is a movement. So we have started this prosperous motherhood movement so that any lady, especially a lady, I'm not saying a couple, any lady who wishes to have a baby should get a chance without having to spend too much of uh, time or money. So it has to be accessible and affordable fertility care which should be provided to each one of these women who are capable of having a pregnancy with little support or even IVF. That should be provided by Government of India, or for that matter any government in the world should provide this access to every woman who wants motherhood.
And how the couple will be benefiting from this SMA Yojana, ma'am?
Through this Samruddha Matrutva Abhiyan, they will get access to fertility care and mostly counseling at closer to their home and earlier in their fertile period. So if they are newly married and they want a gap for a year or two and then they want to start their family, so they are going to get this accessible fertility care, and that is why they will get, most of them would get pregnant, almost I should say about 75 to 80% should get pregnant naturally. They should not require any kind of treatment other than maybe some nutritional support and some counseling regarding the fertility window. At some times maybe they might require some antifungal and antibiotics, that's all. And secondly, in case the remaining 20% or 15 to 20%, they should get pregnant with simple procedures which are non-invasive, like intrauterine insemination. With IUI also some of them should get pregnant. So less than 5% should have to go through IVF.
Yes.
And that also, in, if you know as a doctor, you also know that we have got fertile women who are, most of them, like 75 to 80%, maybe 15%, 15 to 20% might be subfertile.
Yes, ma'am.
And there is very small subsection which is infertile since birth.
Yes, ma'am.
Okay, so that is what is, we are missing this point, that what is since birth, what cannot be corrected or can be corrected, but that was since birth, that I called as infertile.
Yes, ma'am.
Don't call things which which has happened to her due to non-hygienic conditions, malnutrition, whether it is even anemia, or secondary infertility which can cause due to some complications during the first section or during the first delivery. So there could be some sepsis, there could be tubal blockages. Even tubal blockages are mostly not since birth, because of infections, because of some chronic PID, that's what it happens. And PCOD is a big thing which is there around us, and with that can be corrected. That is a metabolic disease, a complete metabolic disease. So that can be corrected with lifestyle changes, with eating habits. So all these things are iatrogenic.
Yes,
it's all because of what we have done in our life, and it is not infertility but subfertility which can be could have been first of all avoided.
Yes,
We could have avoided that. So Samruddha Matrutva Abhiyan is going to help the couples avoid these unnecessary infertility which has been on them, and also about the fertilizers, what we eat also is important. So all these things we are going to we are proposing to the government that the Siddhagiri Jananee module, which is along with Srushti. So Srushti is what, where we have this
couple are getting treatment in a way of government, through the government, ma'am.
Yeah, through PSCs. Through PSCs. You yourself are visiting so many PSCs.
Yes,
you're going to this thing also, Savitri Bai Civil Hospital. So we have kind of an arrangement where we help these women. We don't charge them anything, but we help them get pregnant in their initial phase when they are quite healthy, and so they should not require IVF. IVF can be in one thing, if I can say, with IVF is that IVF should be utilized very rarely, only if required.
Such a great thought, ma'am, and such a great initiative by you. Definitely many of the couple will be benefiting from this Abhiyan. And what is the last one message you want to give it to the population over there on the occasion of World IVF Day?
Yes, so on World IVF Day, I would like to tell the world, globally, everyone should have the priority should be to have a healthy baby for a healthy mother. That would be my message today. Thank you and Jai Hind.
Thank you.
हर घर में गूंजे नन्ही मुस्कान।